Hey, this is Carolyn Wester. It's April 2020, and I'm answering frequently asked questions concerning Summer Camp 2020. The next question is, what is our emergency medicine protocol, and what are the closest hospitals at each camp? Let me begin in California. Let me begin with what our emergency medical protocol is. A couple of things that are super important. If a wrestler has the stomach flu, complains of the stomach flu, says their stomach's upset, we will ask permission from the parent to administer normal protocol, maybe some acid reflux, over-the-counter medicine, Pepto-Bismol, ask them to lie on their right side, and if it doesn't desist, or they have further evidence of having a bug, such as vomiting or intestinal tract issues, we're going to ask that camper to go home. We're not going to handle any of that. If we have a wrestler who has a fever, they have a fever. It's over 99, just a normal fever, and it doesn't go down with the normal protocol of acetaminophen after asking the parents for permission or any kind of fever reducer that they want. It doesn't go down, we're going to ask them to come be picked up. We're not taking them. If a wrestler has an injury, if we feel there's something can be fractured or broken, we're going to call the parents. We're going to take them to the hospital immediately. We're not going to ride around. If your child has asthma, they have any kind of breathing issues, they can't retain their breath, retain their breath once they've had their asthma medicine, or for a few minutes of sitting down, we're going to take them to the hospital and ask that somebody come and get them. Breathing issues are very serious, and it's hard to handle, and nobody wants to handle it. Normally we'll ask them to hold their breath for 10 seconds. If they can't do it, if they can't reoxygenate in the 10 seconds, and they have to cough or expel their air, that's a sign that they need further attention, further treatment, medical treatment that we don't normally adhere to. If someone has a cut, or it doesn't require stitches or anything, we're going to tape them up and ask them to keep wrestling unless they're hurt and need to take a session off. We have a lot of kids that it's very hard. Wrestling prep is very hard after a period of time, and you're asked to do things you've probably not done before. So we have a lot of kids who do say that they're not feeling well, and if they do it more than once, then we share with them that they could go ahead and handle some of the chores that need to be done at camp, like cleaning the bathroom facilities and things of that nature that other people are doing too, or inventory. And if they are too sick to do that, then it's probably time for them to go home, right? Because we just can't handle sickness with all that group of people. In California, the hospital systems that are close to us is Good Samaritan Hospital System in Los Gatos, California. We have a huge Kaiser facility within 20 minutes in San Jose. And then we have Stanford, Lucile Packard Children's Hospital, Stanford University Medical Center. And then if we, for some reason, all those facilities are full, we swing, to the due east, into the East Bay, into Walnut Creek, and it has extremely outstanding hospitals in that area, so that we're all safe. In Northern Virginia, there's an endless amount of very good hospitals. We're in Sterling, Virginia. It's at the epicenter of technology. It's where Amazon's headquarters are, where you'll find Google, all those companies, all the federal contractors are in Northern Virginia. In Northern Virginia, I can't say exactly which hospital we go to first because the ambulatory system works there on rotation. So they call in and say, hey, I've got this injury, I've got suspected broken leg or clavicle, and those are sort of the main injuries that ever happen. But we've only had one broken clavicle and one broken leg, ankle actually, since 2005. So it doesn't happen very often. But they will take them. We have 6 hospital emergency rooms within 15 minutes of the facility in Sterling, Virginia. So hopefully that answers your questions. If your child has a medical pre-existing condition that requires a specific protocol that I am not stated or unaware of, we'd ask you that you document that it be documented on your physician's paperwork with how to handle that, and we'll do it exactly as you ask. Thank you. Please let me know if you have any questions My number is 650-245-3533, and my email is carolynwester63@gmail.com. Thank you.